Welcome to today's press briefing. For the speakers, we have Dr. Chiang Shuk Kwan from the Department of Health and Dr. Linda Yu from Hospital Authority. And Dr. Chiang, please. Last night we have 70 confirmed cases, 6 of which are imported cases, 64 local cases. For the local cases, 25 of those of untraceable origins. For the other cases are linked cases, which include one from the Fong Lin building that's identified at the quarantine center, and one from Yatta related cluster, and one from Cham Kwan El Lam Tin Tunnel related case, and one Ming Lai house related case from a infected unit, and 2 from the dancing club cluster, and 33 of those from other linked cases. For the 70 cases, which include 29 male and 27 male and 43 female, aged between 2 to 90 years old. 20 of those were identified through the temporary testing centers. For the earlier housing estate cluster cases, we went to the Jet Ming Chun and Ming Lai house to take environmental samples, and the samples have all returned negative. And we have one cluster with about 10 cases. In Sun Po Kong King Fuk Street, 新時代工業大廈 called a Billy Sir classroom. And in December, there were 2 days where they held singing lessons with the student mostly around 50s or 60s. And the people were tracked down have been sent to quarantine. New Trend Center. And there we have related cases all together. We had 1 singing instructor and 5 students. And also the friends and the family members of the students put under quarantine. So altogether, there are 10 cases which we will upload it online. For the housing estate, we have Chai Wan King Choi Court. There are 5 units reporting with cases, and 3 units are related, where they have interaction or talk to each other, and 2 cases, one staff working at Fong Shi Chun, which is the source, another one is untraceable. Altogether, there are 3 groups of cases where we will hand out bottles to the residents so they can get tested to detect any abnormality. And the case numbers and the floors are separate and different. Well, occasionally, the overseas returning to Hong Kong have longer incubation period. The experts have suggested to extending the quarantine period and to do more testing. The government have decided that they will take another sample on the 19th day. The Food and Health Bureau will issue a press release to elaborate on their latest arrangements. And that's the end of today's report. Dr. Yu, please. Good afternoon. As of 9 a.m. today, in the past 24 hours, the Hospital Authority have reported a total of 93 cases. In the past 24 hours, we have 2 patients passed away. And this morning, at the Caritas Medical Center, an 85-year-old male, case 6299, passed away. Currently, we have 124 patients at public hospital passed away. In the past 24 hours, we have 24 patients discharged. We have 627 patients and 1 suspected patient discharged. And currently, 1,146 in 23 public hospitals and the Asia World Expo Community Treatment Facility. And 60 of those in critical cases, 61 in a serious condition, 993 in a stable condition. The negative pressure bed stand at 1,241, utilization at 70%. Negative pressure wards at 681, utilization at 76.5%. And I have a few items to report. In the Kowloon Hospital, there's one orthopedic male nurse confirmed last night. His brother and her sister-in-law work as a doctor at the Netherlands Hospital and it's a Chongma Hospital endoscopy center that are confirmed preliminary positive yesterday. This morning, I know there are some family members preliminary positive. The CHP is following up. The 3 cases and their family members on the 13th of December have attended a birthday gathering, which believed that they would cause infection at that gathering. The wife of the Kowloon Hospital nurse also worked as a nurse at the Kowloon Hospital, is now designated as a close contact and sent to quarantine. The diphtheria saliva sample returned negative so far. The few hospitals are performing contact tracing, and the colleagues have been wearing appropriate PPE and do not be exposed to any confirmed cases. No patients have been affected so far, and the contact tracing is still underway. From what we know, at Netherlands Hospital, there are 4 other contacts shall undergo medical surveillance. For Kowloon Hospital, there's no close contact. We have 17 colleagues have all tested negative. For the patients, most of the results came back negative. For the Chongma Hospital, there are 4 nurses have a meal with the endoscopy nurse on different occasions, and 3 of which will be classified as the close contacts. The 4 other colleagues have done the saliva test and came back negative. And I would like to remind the general public that you must reduce social gathering, especially with the winter solstice, Christmas, and New Year coming. Even for families, there are still risks for them to get together. I hope that you can hold off meeting for a while and will not gather for meals or to celebrate. We'd like to remind our healthcare staff and hope that you can be a role model to the public. If you yourself get infected, there will be far-reaching implications than the general public. Besides affecting others and your loved ones, you also may likely to pass on to your colleagues and to patients. I hope that all colleagues shall take that to heart. Besides not together, they should not have a meal together. I hope our colleagues shall cooperate. For the Carinius Medical Center, a 71-year-old male patient on 17th of December was admitted for high blood glucose and fell due to dizziness and admitted to A&E. The chest X-ray shows no signs of pneumonia, and subsequently, he was admitted into the general and geriatric ward for treatment. The hospital then tested a throat saliva test on COVID-19 and came back positive. We immediately arranged the patient to an isolation ward, and the patient is in a stable condition. The hospital infection control team conducting tracing, and 8 patients who shared the same cubicle with the patient are classified as close contacts. And another nurse, while did not wear appropriate PPE while the patient leave a diphtheria saliva sample and classified as a close contact and required to undergo quarantine. The contact tracing is still underway. The hospitals will disinfect the ward where the patient stayed and will continue to monitor the staff and the patients. We know that the transmission to the community is quite severe, and there will be some asymptomatic patients been admitted to the hospital. And by screening, we can identify such patients and reduce the transmission inside the hospital. And finally, on the level of PPE, as of today, we have 70 million surgical masks, the respirators, and 6.6 million. Face shield, 10.6 million, and protective gown, 8.7 million. And was enough to last for 6 months. And that's the end of my report.
Time for questions. Before you ask questions, please introduce which media outlet you're from. From TVP. I'd like to ask about earlier on or yesterday. There's a 62-year-old case, 7900. She passed away and she had been waiting to be sent to the quarantine center. Hundreds of people now are waiting to be sent to the quarantine center. What are the difficulties? How come it took so long to send her to these quarantine center? What guidelines are there? Is it that after they've been confirmed positive, they will be left to wait for a space in the quarantine center? Is there any room for improvement? I'd also like to know today, what's the backlog of people who are still waiting to be sent to the quarantine facility? Would you outsource your work to more people so that the process can be expedited? And also, on a daily basis, how many people can you send to a quarantine center? And how many people are responsible for sending close contact to those facilities? And how many ambulances are on standby for that purpose? And also like to confirm whether the 56-year-old case who passed away and who was confirmed to be infected after she was dead. What's her case number? And did she have chronic illnesses? And how was she like when she was admitted to the hospital? Is it that her situation just deteriorated rapidly and she just died suddenly? I'm responsible for epidemiological study and close contact tracing. As for quarantine arrangement, they are the duty of other group of colleagues. I know they rely on the help of various departments as well. For the details of the difficulties involved, I'm not clear about that. As for Port Oil Hospital, the female patient case, as mentioned earlier, when she was admitted to the hospital, her situation was really bad, and we carried a test on her, and it turned out to be positive. As for her reason of death and whether it's related to the coronavirus, we are not sure at this stage, so we refer her case to the coroner's court for follow-up investigation. Case number is 7916. Next question, please. Dr. Zhang, 7900 case, that many people are concerned about which department is responsible for the quarantine arrangement. How come it took, more than 3 days? 3 days had passed before the lady could be sent to the quarantine center, which, indirectly or directly resulted in her death while she's waiting. Do you know the reason of her death and also her CT value? It's a death result of the virus. And also the Billy Sir singing cluster uncovered today. Were they singing without a mask on? Is it that the reason why the transmission happened? Exactly which days did he organize the singing or conduct the singing classes? Will anyone be required to undergo testing? And 7916 case, CT value was said to be below 30. Do you have the actual figure? And there's also the claim that tests have been performed and the result was negative. How come that the case deteriorated so rapidly? As for details, I'm not really clear about the entire workflow, but normally speaking, once we've issued a quarantine order, the relevant colleagues would liaise with the cases and arrange for ambulance to take them to the hospital. Of course, during the workflow, colleagues need to collaborate with each other. and also in Kwai Western State and Richland Gardens, there were large operations sending residents there to quarantine center. So the workload definitely increased in the past few days. So we'll see how we can further speed up the process of sending people who are close contacts, so waiting to be quarantined, to get them sent to the center in a short period of time. I don't know yet the cause of death as for the other case. As for the singing cluster, every day there were not that many people each time in the class. I think it was about December 5th and 8th that they had the classes. Once the nameless we know of, they've been sent to the quarantine center, and there are cases of actually family members and friends involved, so altogether 10 of them involved. So for people who are not from the family, they will be put on the name list for the cluster. And as for people in the singing group, well, I think one of the reasons for transmission was not wearing masks, and for some cases, even for people who were wearing masks, maybe they were standing or sitting close to each other, or there could be chances of transmission through the gaps of masks, and there were claims that transmission happened even when people were singing with their masks on. And 7916 case, I don't have the relevant details offhand. I'd like the next reporter, please be reminded that WTO has named the coronavirus as COVID-19. In Chinese, it's 新冠病毒.
Our first question about the case in San Hong Kong. Can Dr. Chuang tell us what was the situation during the same classes? Is it a group-based or one-on-one tutorial classes? With or without wearing masks during the class, and whether it's a one-off event or regular classes that a same group of people would meet, and is there a need for mandatory testing there? And the second question regarding Taiwan Estate, King Choi Court. You said 5 flats were involved and 3 of them were related to each other. What was the relationship between the 3 flats? Were they family members that have gatherings, or simply just neighbors? And the last question to Dr. Linda Yu about the hospital staff cases. Do you know whether all of the staff related to the birthday gathering are asymptomatic or not? Do you think anti-epidemic fatigue have happened on hospital staff, that they feel less cautious in terms of social distancing? Thank you.
According to my understanding, the studio, the teacher, and the student ratio may be 1 teacher to 2 or 3 students. So they have, regular classes, but the recent class is in December 5th and December 8th. So because now it's already December 18th, so we have quarantined all those close contacts since December already. So at the moment, because we have the list of participants and the close contacts, so we do not consider it's necessary for compulsory testing. The reason for me to mention this cluster today is because including those teachers and the students and their relatives or close contacts is already 10. So we will upload the numbers on the website. That's why I would like to explain a bit. For the Ging Chui Yuan, we have 5 units affected, but 3 of the units, they have members. The affected cases, they know each other. They may have chat with each other or visit each other. That's why we think those cases are linked. And for the other 2 units, they do not have any linkage with each other. That's why we have already 3 clusters of units. We would like to distribute the defrost saliva bottles to the residents to actively find if there are other cases.
For the 3 HA staff, I understand that 2 of the staff are having symptoms. And we understand that throughout this year, public will feel a bit relaxed or a bit fatigued because it is quite long-standing fight against the COVID. But we understand that recently the community spread is quite severe, and so we will remind our staff to be more vigilant because apart from affecting them or their family, they will also affect their colleagues and also the patients. So we appeal to our staff to remain vigilant and refrain from social gathering.
英文問題。
We'll take an English question, SCMP.
Can you provide some exact figures about the capacity of the quarantine centers? And I have a question about whether the government gives priority to, who does the government give priority to for quarantine measures? And my third question is, what is the situation currently at the Correctional Services Department? I believe last night an officer was confirmed to be preliminary confirmed case. So how many officers have been quarantined at the Correctional Services Department, or are there any more preliminary confirmed cases? And my last question is, could you confirm the location of the Billy Sir bar? Thank you.
We have a capacity of 4,364 units under the quarantine, can be used for quarantine. And we have 1,600 units that can be used at the moment, empty ones. So the Billy 2 studio is in 新蒲崗景福街新時代工貿商業大廈。Correctional Services Department, because there are so many cases, we won't focus any investigation on any case. But usually, this one is a close contact of confirmed case, and he has. I think the Correctional Service Department has issued a press release on those cases. Yeah, I won't elaborate.
下一條嗰邊前邊。
Next. 3 questions. As for the Taiwan King Choi Court, which there are 5 units infected, and what direction they're facing, and how many occupants have been diagnosed, and why the residents are not required to undergo compulsory testing. As for the quarantine residents, and how many people are waiting to receive quarantine, and what is the priority of arranging quarantine? I see the updated information on quarantine centers, which there are 1,600 units available. Why there is still a queue? Do you have a manpower deployment issue? Third question. And for the case 7916, a 56-year-old patient passed away at Port White Hospital. Now you have tested COVID-19 virus in her body, and yet her husband also had a fever and complained to a legislator why he had yet to be sent to quarantine. Does he require to undergo quarantine as well? For the King Choi Court, well, we have 3 units unrelated to each other being infected. We will distribute the bottles first so the residents can get tested early. If we see more than 3 units, they will consider compulsory testing. And for other abnormality and other distribution, we'll consider checking the pipes and so on. For the King Choi Court, even though there are 5 units involved, 3 of them are actually related. Well, they know each other or they met each other. So that's why the 3 units are regarded as one cluster. Currently, we see 3 clusters. That's why we handle the bottles first. For the family members of 7916 required to go under quarantine. As for the logistics of the quarantine, I can't explain too carefully. Of course, it will involve manpower deployment and also other factors. For example, transport, or maybe need to make an appointment. And sometimes the contact may have keep their own pets, which require arrangements, or they may not able to pack up in time, which require a lot of manpower consideration. I know the colleagues are dealing in an emergency basis, and also other departments are helping in to expedite the transport of close contacts to quarantine center or to quarantine hotels. Hong Economic Times. What's the number of preliminary positive cases today? Any of those of untraceable cases? And what is the proportion? For Taiwan King Choi Court Cluster, do you know what is a possible source of transmission? Would you need to examine the building structure? There are about over 70 preliminary positive cases. I don't have the details, otherwise I will tell you now. I'm not referring King Choi Court as having an outbreak. We have multiple cases in a building. We'll check if they are related. Well, maybe there will be some. There is some probability of having multiple cases in a building. Of course, we need to investigate whether there are any linkages. For King Choi Court, even though we have quite a number of units involved, 3 of those were actually related. That's why we're not regarded as 3 units. We'll just treat it as 1 unit instead. And for 2 other units, they're not linked. These 2 don't know each other. Well, currently, we will handle the bottles to the residents to catch any asymptomatic cases or any abnormalities. For example, like in Kwai Ching West Estate or the Richland Gardens, so we can get early diagnosis. Next question. Cable news. For the Billy Sir classroom, when was the earliest case? And you didn't elaborate whether did they sing with their mask off. And for the doctors cluster, and how many attendees at that gathering, and how many persons confirmed so far? For the King Choi Court involving 5 units, and how many persons are involved? Well, it's hard to tell you when's the earliest onset at the top of my head. As around 11th of December, some of those were asymptomatic. Either the 10th or the 11th of December, they start developing onset. Some of them mentioned that they did wear masks. That whether this applies to everyone is hard to tell. Maybe they put their mask on and off. For the preliminary positive cases involving our colleagues, as we know that there's a gathering of more than 10. As for the number of exact preliminary positive, that's pending further follow-up. So which case number you're referring to? We upload it online, so you can extract the case number. Then you know what we're referring to. For the King Choi Court, as for how many cases, they're around 6. 6 cases involving 5 units. Speaker on the mic. Just now I mentioned, well, from what we know, for the Tonghua Hospital, there are 3 colleagues as close contacts. And the Catlin Hospital nurse is also a close contact. While the rest, you need to wait the CHP to follow up. This lady on the back. Mingpao Daily News. For the doctor cluster of the 10-person gathering, how many of those work in public hospitals? Would you affect the service? For the doctor clusters, would you classify as an untraceable case, or some of them have high risk factors with possible transmission source. You have to follow up on the Port Oil hospital disease case husband. And since why his wife has passed for some time and yet husband is not able to arrange quarantine. You claim there are 16 units available. With this number of units vacant, you still can't send the people to quarantine. How many departments are working on it, and which department have hit a manpower bottleneck? Is it the CHP or the Civil Aid Service, the St. John Ambulance, or the Fire Service Department? And can you explain clearly? And have you convey the manpower shortage to the Chief Executive of the Food and Health Bureau so they can be aware of the problem? Now, with 1 year on into the pandemic, with experience for 3 waves, we yet to resolve this bottleneck.
As for Kowloon Hospital, the preliminary positive cases involving colleagues, altogether 4 colleagues in the cluster, that is 4 are colleagues from public hospitals, 3 are preliminary positive, the other 1 is a close contact. As for the sources, I think CHP has to follow up work before we know the answer. As for the procedures for quarantine, I don't have further details to add. Last 2 questions. Lady over there. Stan News. First question. Just then you said that the host said that you could not ask questions using the Wuhan virus. Which law did it violate by using Wuhan virus? If you continue to use the term Wuhan virus, will you be banned from coming to this press briefing again, that we are not allowed to ask any more questions? We don't use Wuhan virus, and we rephrase it as virus discovered in Wuhan, or the epidemic that broke out in China. Is that banned as well? So do we have to use a particular term for German measles as well? And just then you said quarantine is not the responsibility of your department. The Department of Health is responsible for that, but I don't know the details. I can't tell you the details. Well, you said that you're not responsible for that, but I'd like to ask. I also submitted a question to the Department of Health, and the department response is that we should ask you this question at this briefing. But if you said you cannot give me the answer, then who should we go to get an answer? Just trying to answer you. As for the terminology, I think that's not covered by today's briefing. There was rumor that the issue an order. Well, I think we can deal with it later on, because that's not, the terminology is not related to today's topic on the epidemic. If there are no other questions on the epidemic, then the press briefing. Well, any more questions? Dr. Zheng, maybe if you're not familiar with the issue of quarantine center, can you tomorrow invite someone from the quarantine arrangement side to answer our questions tomorrow? Okay, we'll reflect your concern to them, because the public is really concerned about the arrangement for sending people to quarantine centers. People waiting to be sent to quarantine center. They're stuck in a long queue. The last one here. Hong Kong 01. For the quarantine center, they haven't been able to arrange for people to be given a place. And what sort of impact does it have on control of the pandemic? And today's number of cases fell under 70. Can we say that the 4th wave already peaked? There are other factors, of course, that now has led to the ban on dining in the evening. Are you worried about a rebound, however, in the cases? And also for the clusters in the public hospitals, would that be a negative example to the public that they should not be complacent? For each confirmed case or preliminary positive case, we will contact the close contacts as soon as possible and ask them to stay at home. And we'll try to arrange for them to be quarantined. And we also ask those waiting, if they feel unwell, we will ask them to call a number to liaise with us. But if it's an emergency situation, or if they couldn't get hold of our colleagues, or if they lost a number we gave them, then they can call for emergency service. For the 70-plus cases today, well, data on 1 or 2 days cannot represent the whole trend, but I would not say that the cases will continue to go up. I think the case number has been quite stable, but does it mean that they are coming down? I'm not sure. And if there are special situations, like if there is a sudden outbreak, then cases could spike again. So figures from 1 or 2 days, I still think that cannot suggest the overall trend, what the overall trend will be like. And for the coming holiday periods, we are concerned, worried, because there could be some family gatherings, celebration of the winter solstice, and so forth. Earlier on, we've seen that for family gatherings, they never really stopped. There are still, habitual gatherings, the siblings going to their parents' homes or family members' homes on a weekly basis for meals, get-togethers. That's a normal family activity. But in today's, under today's pandemic, because of the outbreaks in the community, there could be invisible transmission of viruses, and people may not know that they are carriers of the virus. So within the family, often it could be, other family members or elderly people, individual members who develop the symptoms, and then other people could be infected as a result. We don't want to see that happen. So I think in terms of family gatherings, I think the public need to consider whether they really should or want to go ahead with them. As we said earlier on, we understand, including our colleagues, or we know that they've been fighting the pandemic for so long, and there can be pandemic fatigue, and they do want to celebrate together. As Dr. Jones said, they might want to have some regular gatherings, but since the fourth wave occurred, situation has been serious. So I'd like to remind the public and also our colleagues, they need to set a good example for the public, and they should try to minimize times of having gatherings. Press briefing comes to an end here. Thank you.